Honey, it's time for your doctor's appointment. Let's go.
Wait, I want to watch this. Can we get a cat?
Sure.
He's neutered.
Them all, hip spectacles, no testicles.
That's right.
He lost his pair of balls.
He's neutered, the neutered cat.
Find low-cost spay and neuter options at GiveThem10.org.
Hi, Monica. I'm Dr. Anderson.
Hi.
And this is my resident, Dr. Pepper.
Nice to meet you.
So you're in your first trimester of pregnancy right now, and everything looks to be going great. Has anything changed since last time we've seen you?
I mean, I don't think nothing much has changed. I mean, the only thing is that we're thinking of getting our first cat. So excited for that.
Do you see a problem with this, Dr. Pepper?
You know, why get one cat when you could totally get two?
True.
Well, wrong, because dogs are better. But on a serious note, getting a cat for the first time during pregnancy could lead to serious complications and health conditions for you, but also your child. Okay, let me explain. There's a disease that affects nearly 60 million people in the United States alone, called Toxoplasmosis. This disease is caused by a parasite that enters the body from particles in infected cat feces and infected meats. The parasite then divides within the body and either kills cells or sits dormant in various body tissues. But since you're a healthy individual, I don't think you'll likely experience any symptoms except symptoms of a common cold, because your immune system will destroy the active parasites. But this doesn't mean it's gone, because many parasites can still stay in your body embedded in tissue without causing the effects of the disease. My particular concern is that the disease can be passed on to your child, and it's the most serious effect during the first trimester of pregnancy, but could result in miscarriage, stillbirth, and abortion. Now, if you make it to term, the child could be born with encephalitis, develop blindness, and there is also potential for development of mental disabilities.
Seems like we're not getting a cat for a very, very long time. Is there anything else we need to know?
Nope, I think that's it for today. You guys are set for a wonderful birthing experience.
Okay, thanks.
It was nice seeing you again, Monica.
Nice seeing you. Too, Dr. Pepper.
Oh, hey, Dr. Anderson.
Hi, how are you?
Not too bad.
So about earlier today, did you really not know what toxoplasmosis is?
Well, you know, I was just so nervous. I really haven't had that many interactions with patients before, but I like to think I know quite a bit.
Well, in that case, let me see what you know.
Toxoplasmosis is one of the leading parasitic diseases in the world, and it's caused by the sporozoa Toxoplasma gondii. It's obtained by the ingestion of oocysts of feline feces or oocysts in contaminated meat. And there's basically 3 stages to the disease. The first starts on the ingestion of the oocyst as it enters the body and travels through the GI tract where it comes to rest in the intestines. Then the acute stage of the disease starts when you have the oocysts that turn into tachyocytes, the active parasites. They travel through the body and the cells, and they attach to muscular, CNS, and ocular tissue.
Go on.
So ultimately, many of the parasites are going to lay dormant in tissue cysts throughout the body, while others are phagocytized by macrophages of the host cells. One important thing to note about toxoplasmosis is that communication between human hosts only occurs via vertical transmission.
Wow, I'm impressed.
Thanks, doctor.
Now, before we go on, why do you think this was so important in the case that we had today?
Well, that depends on whether that woman had been infected before. If a woman has been infected with Toxoplasma gondii prior to pregnancy, her offspring will be immune and suffer no effects of the pathogen. But if the woman is infected for the first time within the first trimester of pregnancy, toxoplasmosis can be passed congenitally through the placenta to her fetus. The results of congenital toxoplasmosis are very serious and often result in a miscarriage, stillbirth, encephalitis, retinochoroiditis, mental disability, and seizures.
Well, how do you think we can treat this disease?
Well, the first step prior to treatment would be getting a positive diagnosis. This is going to be done by running a Toxoplasma serological profile. It consists of several different tests, rapid ELISAs looking for the immunoglobulins G, M, and E, and also a Sabin-Feldman dye test. Positive diagnosis from those can lead to treatment generally for those who are immunosuppressed. First-line treatment is going to be a combination of several drugs. Pyrimethamine, 50 to 75 milligrams by mouth once daily, sulfadiazine, 1 gram by mouth 4 times daily, or alternatively clindamycin. And then also a supplement of folinic acid, 5 to 25 milligrams, can be taken by mouth once daily. These medications are going to work in tandem to eliminate the acute stage of the disease, but they do not always completely eradicate it from the body because, again, the parasite can lie dormant in tissue cysts.
So how do you think we should proceed with this patient?
Well, clearly we made the right decision in talking her out of getting a cat, but we could talk to her about further preventative measures, such as maintaining a healthy immune system through diet and exercise, practicing good sanitary habits, avoiding cats at least until her child is born, and being sure to cook meat thoroughly to kill off any oocysts that could have the contamination in it.
Sounds great.
All right.
Honey, look at our baby boy. I'm so glad everything went well. Now we can get a cat.
Sure. Let's see that beautiful baby Rodney's face.
He's neutered. He's neutered.
And the coolest